Good afternoon. Thank you all for joining today's press briefing. First, we will hear from Mayor Tom Barrett. Then we will hear from County Executive David Crowley. Next, Ben Weston, Director of Medical Services for Office of Emergency Management. Darren Roush, Health Officer and Director for Greenfield Health Department. And Dr. Jeanette Kowalik, Commissioner for the City of Milwaukee Health Department. Thank you all for joining. And Mayor Barrett, we'll start with you.
Thank you very much, Catherine, and good afternoon. It's a gorgeous day here in Milwaukee, but we're continuing to do the work that we need to do to get this pandemic under control. And I just want to give you a quick update. Right now we have over 17,000 cases, confirmed positive cases. In fact, the number is 17,788 confirmed positive cases and 277 deaths in the county. And this is something that remains obviously a growing concern for us. One of the keys to bringing this number down is testing. And unfortunately, our testing numbers continue to decline each week. And we don't like to see that. I want to continue to stress that testing remains of critical importance as we fight this pandemic. So as of today, our National Guard testing site numbers are 660 for UMOS, which is located on the south side on South Chase. Custer High School on the north side, just off Sherman, 305. So a total of 965 individuals have been tested. We have a lot more capacity, and in other parts of the country, they actually don't have this capacity, but this is something that locally we've made a priority. The state has made it a priority. So we do have the testing that is there. The turnaround time on the testing is relatively quick. So again, feel free to be using these spots. Now let me give you an update on our key indicators. We have now gone from 3 greens and 2 yellows last week to 4 yellows and 1 green this week. Our cases indicator went from green to yellow, meaning there is no longer a significant downward trend in cases. Our testing indicator also went from green to yellow. As I mentioned earlier, we're seeing a decline in these daily performed tests, and our benchmark is 2,000, and right now we're at an average of 1,548 tests being performed daily. So the good news to report, though, is that our positivity rate still remains relatively constant. We are reporting a 5.3% positivity rate of cases. That's good to note because it's now under 6% for the past 3 weeks. Our care, our PPE, and our contact tracing metrics also have remained at where they are. Now I'd like to switch gears for a second to talk about early voting, because what we've really tried to do, and this goes all the way back to April, is to try to figure out what is the best way to conduct an election during the midst of a pandemic. And as you may recall, back in April, with the last-minute decisions by the state Supreme Court, by the last-minute decision by the United States Supreme Court, by the decision to override the governor's order pertaining to the election, it was a challenge, and it was a challenge, very much a challenge here. We don't want to see that challenge repeated, and so we're doing everything we can to make sure that we have an adequate and safe supply of places for people to vote. So earlier this week, I was joined by representatives from the Brewers, from the Bucks, as well as the president of the Common Council, Cavalier Johnson, to announce the addition of 2 new early voting centers, Pfizer Forum and Miller Park. And dare I say it, Pfizer Forum was a slam dunk, and Miller Park is a grand slam home run, because these are 2 ideal locations. Pfizer Forum for people who want to come from a bus or want to be downtown to do it, centrally located. Miller Park for those who want to do a drive-through voting, which we experimented with in April with great success, although the lines are long. And so we feel that having these 2 locations really are going to be absolutely fabulous for allowing more people to exercise their right to vote. These are for early voting, so we're not talking about November 3rd, we're talking about early voting. And nationally, Milwaukee has become the leader by providing both of these locations for early voting. I don't think there's another city in the country that's using an NBA arena and a Major League Baseball stadium for early voting. That tells you how seriously we want to make sure that we have safe voting, because this is all being driven by the COVID-19 pandemic. our desire to make sure that we've got safe, accessible voting, because the election is in essence going to be a marriage between our election commission and our health department. So prior to this announcement, we had already announced an additional 15 locations throughout the city of Milwaukee. So people are going to have an opportunity to vote, that's for sure. We anticipate increased voter turnout for 2020 general election. If you haven't noticed, there's a few commercials on TV already. And with the ongoing pandemic, we want to make sure that our in-person voting locations comply with the CDC guidelines to keep voters safe. And there really has been a seismic shift in how people vote. Prior to this year, we ordinarily would see 70% of the individuals vote in person and 20 to 30% vote absentee. In the April election, we saw those percentages flip. That flipped percentage held in the August election. So we're anticipating a lot more people voting early through the mail, and they can return it through the mail, or we will have many, many drop boxes that we'll talk about in future meetings for people to go, or they can send them back in, as I said, or they can vote in person on November 3rd. So there are challenges. We know that voting by mail is not the best option for every voter. There was a 3% rejection rate in the April election due to issues like ballots not being returned on time or not having the correct signatures. So offering in-person absentee voting at larger sites offers a greater opportunity for social distancing and furthers racial equity and access to in-person voting opportunities. So Fiserv Forum will be used for in-person early voting beginning October 20th through November 1st. It will be open from 8 a.m. to 7 p.m. Monday through Friday, and 10 a.m. to 4 p.m. on Saturdays and Sundays. In addition, during the April election, the city saw a large increase in drive-through voting. In fact, over 6,000 voters cast their ballot from their car. And Miller Park will provide a safe and efficient drive-through early voting for the November election. And we will be announcing the dates and times for that later on. But they will both be used exclusively for early voting. So don't show up at these sites on November 3rd. I want to praise our election commission, which has been working diligently to help people. And we're still working to recruit an additional 750 election day workers to ensure the lines are not congested, that polling places are cleaned and disinfected frequently, and that there's a safety net should any staff members fall ill. Any Milwaukee County residents who are interested in working as a poll worker can apply at milwaukee.gov/election. And I will also point out that we've raised the pay for that from $130 for the day to $230. So that's a $100 increase to work that day. Finally, I will do this, I'm sure, more, but I want to give a huge thank you and acknowledge Commissioner Kowalik, who announced yesterday that she has accepted a new position in Washington, D.C., where she can affect policy. We're hoping she can redirect federal dollars back to the city of Milwaukee, but she has been such a strong voice for racial equity and dealing with these issues here locally. She caught the attention of an organization in Washington, and while we're sorry to see her go, we wish her the best, and we'll hear more about that, and we'll hear from the commissioner today. So with that, I want to turn it over to County Executive Crowley and thank him for all the work that he's doing as well. Thank you very much.
Thank you so much, Mayor Barrett, and thank you for your leadership as well. And hopefully she can bring more money to Milwaukee County as well. And so I want to echo the mayor's sentiments in thanking Commissioner Kowalik for the service she's provided to the city of Milwaukee, especially during these challenging times. And I know she's on, so I want to speak to her directly and say, your leadership and your commitment to addressing systemic racial inequities in our health system is greatly appreciated. And we look forward to the work that you'll be doing in DC at the policy level and fighting for health equity. And just to go back on schedule, as we look at Milwaukee County and what we're looking to do here to address systemic inequities, we're taking a hard look at our budget. And so as we continue to let you know that we're facing a $42.5 million deficit, and we're turning to the community for creative ways to really address these financial challenges. We've already hosted 2 town hall meetings already, and we received great feedback from the community. But we want to let you know that we have another one coming up that will be offered virtually and in person on Tuesday, September 8th at 6 p.m. right here in the Milwaukee County Courthouse. Everyone is welcome, but we highly encourage folks to attend virtually. If you don't have access to the internet, we welcome you to come into the courthouse to attend in person, but please note masks are required. So please make sure to register and submit questions 24 hours in advance. And if you're not able to attend the town hall, please take 15 minutes out of your day to fill out the Balancing Act tool on the county homepage. And all the feedback and suggestions are welcome and valued. And finally, we have a holiday weekend coming up. If you're going to be traveling, masks are required at Mitchell International Airport. Also on Labor Day, our buses will operate on a Sunday holiday schedule. So keep that in mind as you plan your day. The zoo will remain open from 9:30 a.m. to 3 p.m. for the holiday weekend. Reservations are not required, but capacity still remains limited. Please remember, the decisions you make now will impact our community in the future. The best way to mitigate the virus is, again, to continue to remember the 3 W's. Wash your hands, wear a mask, and watch your distance. And so I want to thank everybody for being with us today as we continue to talk about COVID. And I'll turn it directly over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First to our numbers, we've had 24,319 confirmed cases of COVID-19 in our community and 409 individuals who've died. So first, I'd like to join the County Executive and the Mayor in congratulating Commissioner Kowalik on not only her new position, but to recognize the work that she's done for the city over the last couple of years, and of course, particularly the last 6 months or so. I think these last few months have been professionally as well as personally challenging for our public health officials, and we are so grateful for the tireless work they've done and continue to do to keep our community members safe. So thank you. And that work is reflected in the promising trends that we're seeing as a community. We're now seeing the lowest case counts since May, positivity rates that are consistently around 5%. That's the lowest we've seen in the last 2 months. And we're seeing COVID-19 hospitalizations lower than any time since we started tracking them in April. So these are trends and numbers for which we can certainly be proud for the collective as well as the individual actions taken in our community to prevent the spread of disease. However, as we've seen in the past, these numbers can be fleeting. And with schools reopening, with fall and the accompanying cold and flu season approaching, and a holiday of gathering coming this weekend, we have to be cautious. Labor Day is a great time to enjoy the few remaining days of warm weather and gather with family and friends, and that's fine. It's okay to get together with others, but it's important, it is important for each of our mental health and for our well-being, but we must do it safely. So that means wearing masks, gathering only outdoors, and distance, keeping 6 feet of distance between yourself and others. So let's work to see these promising trends continue for the weeks and the months to come. And lastly, as mentioned, one trend that is not as promising, the one really concerning trend are our testing numbers. So over the last 6 weeks, we've seen steadily decreasing numbers of individuals seeking out testing in our community. Testing is particularly low in some areas, the southern half of the county, as well as the northern part of the city of Milwaukee. But really for anyone, no matter where you live, please seek out testing if you have symptoms of COVID, if you've been exposed to someone who is diagnosed with COVID, or certainly if you're referred by a public health or healthcare professional. And seeking out testing, we've made it as simple as we can. So you can call your healthcare provider if you have one, you can call 211, or you can just go to one of the National Guard testing sites. It's crucial to get tested, especially when symptoms arise, to prevent the spread of disease. Thank you very much. Stay safe, and I will hand it off to Director Rausch of Greenfield Health Department.
Thank you very much, Dr. Weston. My name is Darren Rausch with the Greenfield Health Department, and I'm here today to talk to you about some of the data as it relates to COVID-19. So I'm going to go ahead here and share my screen. And there's a couple exciting things I want to talk about today. We'll talk about the kids data report that we've talked about in previous weeks. We'll talk about the whole county data report in brief. But one of the first things I wanted to start with today was talking about outbreaks, and specifically COVID-19 related outbreaks. There was a lot of attention this spring about COVID related outbreaks in nursing homes, long-term care centers, workplaces, factories, et cetera, et cetera. And we created a short report back in May to talk about that. And we have recently updated that data, and we wanted to walk you through it today. As well as this will be available through Catherine for any media who are interested. So On the screen here in front of you, just to orient you, any of the cases in orange, and so these are daily cases by specimen collection date, are cases associated with a group quarters outbreak. So a congregate living facility like a community behavioral residential facility, a long-term care, a senior apartment complex. The cases that are reflected there in blue are associated with non-group quarters outbreaks. So these are workplaces, events, sports camps, summer camp, et cetera, et cetera. And then the cases that I would call purple, others may call magenta if they're more fashion forward, are associated with are not associated with outbreaks at all. So these are cases that are happening in the community but that aren't linked to an event, a workplace, or a residential facility. So by and large, cases in Milwaukee County are not associated with outbreak settings, events, or places. What we see here on this daily map of cases, when we look at the 7-day averages, we see that we had 3 distinct peaks of COVID-19 in Milwaukee County. We had a peak in late March, we had a peak here in mid-May, and we had another peak in mid-July. And these were the cases that were community acquired, not associated with any outbreaks. We do see little peaks and valleys in here related to non-group quarters and group quarters outbreaks, but generally the trend is largely flat. When we talk about hospitalizations, again, a larger percentage of hospitalizations related to group quarters outbreaks. And then when we talk about deaths, certainly a large number of deaths were affiliated with group quarters, congregate living type settings. So these are hospice locations, community residential facilities, long-term care. So the data does portend that most of our cases in group living were more likely to pass than cases in workplaces and other cases that were in our community. The report goes on to talk about more, breaking it down by age and demographics, and you can kind of see that here on the screen as well. But then we also conclude the report talking about specifically the different outbreak types. So we reflect in here the House of Correction, which was a very active site in April and June for outbreaks. We talk about adult residential facilities, again, long-term care, senior apartment complexes here. These graphs all paint a picture of how many positive cases were there versus the number of negatives that were tested in each of those facilities. And in some of these cases, in some of these broad areas, testing probably wasn't done to the extent we would have really liked, but certainly in residential facilities, widespread testing was done pretty actively throughout the outbreak. We had meat processing related outbreaks. So you see those scattered here in April and then still kind of continuing at a very low rate into September. We have outbreaks noted here related to other food plants. We have manufacturing related outbreaks. So again, these are all broken down by date and time and looked at the data more specifically by age and age category. And yes, indeed, we did have some cases associated with schools, childcare, child sports activities, and summer camps. And again, while the numbers are low, they certainly were something that we were monitoring closely during the year. So that report will be made available after this briefing. Just shifting gears here a little bit to talk about kids. We do know there's lots of schools that have started back either in person or virtually this week. We know there's other schools that have started back over the last couple weeks. In our children's report, we reflect 10.2% positivity, almost 3,000 cases of COVID-19 in children under the age of 18, with 48 hospitalizations and 0 deaths. In the last week, 9.1% of positive tests were identified in those under age 18. So we're seeing, as I walk through this report, a little bit different story in the youth cases than we're seeing in the adult general population cases. Here's our cases over time. You can definitely see here that we have had similar trends here than we see in our general population. And very specifically, we look here very recently, and it looks like the suburban average 7 days and the city's average 7 days are intersecting or overlapping. So that's notable because obviously cases in the suburban communities have been much less throughout the outbreak. So for kids, they're certainly looking like they're going to intersect soon, and we'll continue to monitor that. Demographic trends hold similar with what we've seen before. I just want to kind of talk about how the cases increase as kids get older. We've talked about that in the past. The older kids are obviously more likely to be engaging in activities and to be in more contact with others, which is putting them likely at more risk of developing COVID. So we certainly see that increase, but not to be outdone here, we do have to reflect that there are more cases in the under 1 year of age population than there is for many of the individual ages up until about age 6. So there are a lot of cases in infants, and that's something that we've been watching closely. I'm going to end the talk about the kids report just looking at testing data. As has been described earlier on this briefing, testing data has continued to decrease by and large. We see here a couple plateau periods over 3 weeks over the last month amongst children. But what we see down here in the lower right is a trend that we don't want to see. While it's not statistically significant, we see a very increasing trend of percent positivity amongst those tested for COVID under the age of 18. And that's something that we're going to want to continue to watch. And then I'll show you the activity of COVID cases amongst the under 18 age over the last week. This is going to be a very similar picture I'll show you when we talk about the entire population. A lot of activity in some of the North Shore communities, the northwest part of Milwaukee, as well as kind of south of I-94, which bears some additional looking. And then lastly, let's just switch and talk about the entire county report. So this is looking at everybody in the county. We've broken out the summary data on the first page. We've talked about the successful percent positivity over the last week, which is favorable and certainly moving in the right direction, or at least holding steady. Here's our look at the average daily number of cases. And again here, just like with the kids, we're watching that intersection of the suburban 7-day rate and the city 7-day rate very carefully. Deaths have been largely holding pretty steady for the last couple months, and steady and low, which is a very positive thing as well. Our growth rates and our transmission rates continue to stay largely below 1. We reflect on August 1st, the statewide mask order happened. Milwaukee's went into effect 2 weeks earlier. Largely since then, throughout the county, we've been below 1. We've been able to suppress that transmission rate, which is very, very positive. Skipping down to testing information, I'll report and reflect that, Dr. Weston and others have said our testing numbers have continued to decrease pretty significantly over the last 2 months. You see are reflected here of a general downward trend over the last 8 weeks. I implore you, if you need testing, you want to be tested, testing is available. Our trends here for the general population remain pretty flat, right around 5%, but remember, amongst our youth, that percentage has been increasing, so it will bear additional watching. And I will end today just by talking about what's been happening in the last week in the county as far as COVID new cases. And here is the map looking at the entirety of the population. And again, a very similar picture of what we saw with the youth. A lot of cases in the southern part of Milwaukee, the southern and western suburbs, and then clusters of activity on the northwest side and in the North Shore communities. So again, a lot of disease happening throughout our communities. And that is a consistent message that we've been sharing. While the numbers are down, we still need to remain vigilant. Local health departments across Milwaukee County are continuing to diligently monitor these trends, provide the best information for all of you, and we continue to not only work within our county borders, but also with our colleagues across southeastern Wisconsin. Today, we had a regional call to work to align and coordinate our COVID-19 response efforts and to share new and forthcoming information as other schools have opened throughout the region, as we've tackled other issues throughout the region related to COVID-19. Of particular interest today was the issue and the topic of schools and school reopenings, since many of the schools in the region have started this week, and many of the private and parochial schools have started over the last couple weeks. As expected, schools have been having positive cases throughout the region. We have seen and heard cases identified in staff, students, and faculty in these schools. We have seen that positive cases have been isolated, as we have throughout the outbreak. We have quarantined individuals who have been exposed. However, what we're finding anecdotally throughout the region is that many parents are not following through on the parental responsibility and the public health measures to keep kids home. Specifically, some of our colleagues have mentioned and outlined situations where parents have sent their COVID positive child to school. Additionally, departments have identified that many parents have not been quarantining their child appropriately and have sent that child to school or to a daycare setting. These issues raise very important reminders for everyone. All residents need to understand and need to remember that the success of our public health initiatives need you to make those effective. We need your help. So first, what can you do to help us? First, we need you to answer your phone when public health contact tracers call. We'll be asking you questions related to your symptoms. We'll be asking you questions related to close contacts and where you've been. We need this type of information to help identify a source for your illness and to identify potential places where you've been and potential people that you may have exposed where you could have spread illness. We will never ask for personal information, as some of the recent scams have outlined. We will never ask for banking information, credit card information, social security numbers, immigration status. These are perpetuated by scams, and it really does damage to the good work that public health is doing in trying to control and investigate COVID-19. More importantly, when we call you, please provide honest and forthright answers to the questions we have. Way too often, my staff and colleagues have reported that an interviewee was obstinate and did not provide the information needed. Further, when you tell us that you, quote, won't give us the information, end quote, that doesn't help us to fight COVID-19. Instead, misinformation, lies, and mistruths continue to perpetuate COVID-19 in our communities and keeps us from returning to a sense of normalcy. Lastly, let me just mention that public health is always focused on education, information, and compliance. We've focused on outreach and information for months. We're 6+ months into the COVID pandemic. Unfortunately, all of our efforts have not reached the residents that we need to reach. And for some reason, some individuals are choosing not to comply with that guidance and with those recommendations. As such, public health in your communities may be forced to take greater enforcement actions within our authority. Collectively, my colleagues and I don't take these actions lightly. But I want to point out that obstructing a disease investigator and a communicable disease investigation is a violation of Wisconsin Statute 252.05 and local ordinances. Further, failure to isolate and quarantine is a violation of Wisconsin Statute 252.06 and other local public health ordinances. As I've said before, and others have said on these briefings, the fate of our success in controlling COVID-19 rests in your hands. Our collective actions in response to COVID test results and potential exposures have had and will continue to have a direct impact on our COVID-19 case rates and outbreaks in our community. Please, I implore you, continue to do everything you can to keep yourself and others safe. Thank you, and I'll now turn the briefing over to my colleague, Jeanette Kowalik.
Good afternoon, everyone. So yeah, it's good to be on a Thursday, normally Tuesday, but I know Tuesday was canceled due to the presidential visit. So first, I just want to acknowledge Mayor Barrett, County Executive Crowley, Dr. Weston, for the congratulations and support for just public health in general and our COVID response. So it definitely has not been easy. And I had to make a decision that okay, I only have so much energy left. What am I going to do? Am I going to stay in this role at the local level and keep spinning my wheels? Or will I take my skills and talents to the national level to provide more broader impact for other states and jurisdictions? So I'm very happy that I had the opportunity, that I was recruited for this opportunity. So it's nice for people to pay attention to your efforts and to see that you would be a great asset and a team member. So I'm happy that this opportunity presented itself now. And you may wonder, it's like, oh, well, we're in the middle of a pandemic, why are you leaving? Well, one thing, if you have been paying attention to the national news, that there has been a lot of turnover at the commissioner and health officer level across the country, whether it be the state level or local level. I mean, even the state of Wisconsin, our state health officer left a couple of months ago. So some of the reasons for people leaving are related to being forced out, or there being rubs with public health professionals' values and training in public health versus political pressures. And my reason isn't related to political pressure in my jurisdiction. I'm grateful that Mayor Barrett has supported my ability to issue orders, but I know that others have not been able to do the same. So we also had to be mindful of issuing orders for the city of Milwaukee, and knowing that the surrounding jurisdictions did not issue orders or were not able to issue orders, and how that impacted us. We became an island to ourselves, and we were very grateful that we were able to move ahead with a mask ordinance as a backup, just in case there were any challenges to our orders that were successful. And so far, so good. No challenges have been successful, but just having an ordinance in place, so just the collaboration and quick thinking of our alders and our mayor to be able to get that through. Then, of course, being able to benefit from a statewide mask order, so that we know that disease is not specific to city limits or boundaries, that they are more so related to movement of people. So our area is a region, and we have many people that live in one city but work in another, or their kids go to school in a jurisdiction outside of their own. So this is why it's important to have the ability to have broader reaching orders and enforcement of these orders to protect our community. We know that COVID is a new disease, and we know we're learning more and more about it. We're embracing mask wearing. We're seeing that wearing masks is making a difference. We don't have a randomized controlled trial to support that statement yet, but if you just look at our local stats from when the mask order from the state and the local mask ordinance took effect, you can see a difference. So we want to continue to promote proper mask wearing, provide access to masks, because we know everyone doesn't have the means to purchase their own masks. And then, of course, the education on the proper use, just repeating that message that anyone over the age of 3 needs to wear a mask. So I just want to just highlight a couple of points there, and then kind of cycling back to what's happening in the city of Milwaukee and what we're doing. So we are still requiring submission of COVID safety plans for schools that want to have the option to have in-person instruction. So far, we've received 150 plans. So those plans are still being reviewed, and Deputy Jackson and her team are doing an amazing job providing support to schools, consultation, making sure kids are safe. Also for restaurants and bars, we have a deadline of the 15th of September for submission of COVID safety plans. So Deputy Evers is leading that charge, and her team is doing an amazing job. We want to encourage any operator of a restaurant or bar, if you have multiple locations, please get your plans in. I know some people like to wait until the deadline to submit plans or whatever is due on that date for the rush, but please get it in earlier so that we can prioritize your plan review and get it done. We do anticipate that we will receive some on the date. Remember, this is to continue to provide in-person dining, whether it be indoor or outdoor. We know that the cold weather months are coming, So having an approved COVID safety plan will be extremely important to help move Milwaukee forward safely. And also, as far as the numbers of plans, we have received 220 of those bar and restaurant plans, and 105 are approved. So sometimes there's some exchange, some communication that happens with plan review adjustments that need to be made before they can be approved. So you know that's why there is some variance in what was received versus what is approved. Also, just again, I just want to highlight the importance of proper mask wearing as we go into Labor Day weekend. And we know that, you know, many people, this is their last attempt to have some type of gathering or barbecue or something along those lines. So we encourage you to do so safely, as the county exec noted, that you can still gather but do it outside, distance, make sure there's access to hand sanitizer and wipes, and that you all are wearing masks. So I'm just going to show you, this is one of our latest City of Milwaukee Health Department masks. And again, we're purchasing thousands of masks for our residents, and they will be available through a variety of access points throughout the city. If you go to milwaukee.gov/masks, you can see all of the sites, and more sites will be populated aside from the Milwaukee Health Department clinics, which are listed now. But this is just a very clean, simple mask. And you know, I normally wear like really jazzy masks, but just to show you again, proper mask wearing. So make sure the mask is over your nose, right? And then it goes to the bottom of your chin. You shouldn't like keep touching the mask when you're breathing, because you can be possibly like spreading the viral matter to yourself if you're touching other parts. So make sure you wash your hands after touching the mask. You see it's fogging up a little bit. That's because there's no metal here. You can put a paper clip, or there's other little like pins you can put into a mask to make it fit your nose, and that eliminates the fog, because I know that sometimes that comes up as a question. But I just again want to show you, because I still see the low writing, and that's half use of the mask, not as effective. And then let's see here. It looks like I got a question about my resignation comment about factors, and I had a conversation with some reporters from the Milwaukee Journal that kind of elaborated what that means. And as Darren noted, as a local health officer, we're only successful if there's cooperation, right? So we not only need cooperation from the community, meaning parents, residents, you know, you name it, we need cooperation from our policymakers as well. So we know that there has been a tendency to turn COVID into this political battle. So if you wear a mask, you support this person. If you don't wear a mask, you support that person, which is totally bogus. We need to take back the messaging that wearing a mask is for not only ourselves, but for others, period. It does not matter what your political leanings are. It's about preventing the spread of COVID-19. The other side of this is when I talk about cooperation from our legislators. So we know that there was 2 instances where the Wisconsin Supreme Court was brought in to pretty much take away our ability to have statewide support. So we talked about the election. So as the mayor noted, the spring or April election, that we still had to have it considering the circumstances. And then in May, when the safer at home order was removed. So that whole concept was to move the authority back to the local level. But we know that every jurisdiction was not able to do that due to various political constraints in those areas. So I say this because although I had the benefit of having a mayor and a city attorney that supported my ability to issue a local order, what good is the order? And I shouldn't say what good is the order, but the order is not as effective if it's just in my city limits. It needs to be regional. It needs to be statewide. There needs to be support because people move around. As I noted earlier, people live, work, play, go to school in various jurisdictions in our region. So by just having an order in one specific geographic area and boundary, that's very limiting. I mean, we were able to provide some supports by still maintaining an order. So I don't want anyone listening to this to think that this was all in vain, that there was some protective effects for having a local order, but it could have been more magnified if we had a regional approach, a statewide approach, like we did for the first 2.5 months of our COVID response. So that's why I mention that, because I know that many of my colleagues in other parts of the country either were supported or not in their ability to issue orders. And it's one of our tools as a health officer to be able to issue orders, not because we're power tripping or anything like that. We're doing it with the intent of reducing the spread of an emerging infectious disease to save lives. And I know that there's also been some controversy about how deaths are recorded and looking at if people have underlying health conditions or anything like that. And I want everyone to know that it doesn't matter if you have an underlying health condition and you got COVID and that's what you passed away from. I mean, my grandfather, God rest his soul, he passed away from carbon monoxide poisoning. And his primary cause of death was carbon monoxide poisoning. His secondary cause of death was heart disease. Then we say, oh, the carbon monoxide didn't matter? No, because he had heart disease. So I just want everybody to think about some of these narratives that are being spun, and they're harmful and they create division in our community. So please be mindful. I would hope that you wouldn't have to have lost anybody due to COVID-19 for you to care about it. We should be thinking about one another, and when we're divided, we're weak. So that's one of my appeals as I'm leaving and heading off to DC to advocate for us at the local level, is that we take the high road and that we really work together to get through this crisis. COVID is going to be with us for at least another year, if not more. So thank you all for the opportunity to serve, and I have 3 more weeks of updates with you all before I head off.
Well, thank you, Commissioner Kowalik, and I will also echo all of the sentiments already shared. We really appreciate your time and your leadership. It's been invaluable having it locally as well as on the briefings, and you will be missed, but we're excited to see what the next journey holds for you.
Thank you. Thank you.
Thank you. And you've started to answer some of the questions in the chat, but Sharon Bajenda from CBS 58 has a few. She says, Dr. Kowalik, will this be your last COVID-19 briefing with us? And could you expand on your future plans with TFAH?
Yeah, so I have 3 more weeks. So the 22nd is my last day. So as long as there's no presidential visit, we'll still have a Tuesday briefing. So that will be my last one. So, I'll make sure I bring the thunder with my fashion that day. But, again, just the opportunity to get us to a place like where our numbers are decent. I mean, we're making some progress, and holding the line is progress, believe it or not. But we still have to monitor school reopenings and, some of the misinformation that's cycling about COVID and whatnot. So we just want to continue to make sure people are informed and they can make decisions using credible information and not their aunt's Facebook page. Many of us have many years of education and training here. We have Dr. Weston and Darren and myself. So just again, who is your messenger? Who are you getting information from? And then as far as what I would be doing in Washington, I will be the Director of Policy Development for the Trust for America's Health. And so the Trust for America's Health has been a force in public health policy for many years. And it's a bipartisan organization, definitely provides guidance and support to senators and representatives and other stakeholders in our space, but not just in the health space, but also working with other sectors. And more importantly, I would have the ability to develop policy using an equity lens. So some of the things that I've been able to do locally I'll be able to do nationally. So that's what I'm talking about. It's like energy, moving to a different level of impact, providing support, not just for Milwaukee and the state of Wisconsin, but for others as well.
Very exciting.
Thanks.
Sharon's next question is for Mayor Barrett. She asks, what are your plans to fill Dr. Kowalek's spot as Milwaukee Health Commissioner? And will there be an interim handling the health concerns surrounding COVID-19?
Well, one of the things that I've learned over the last 6 months, because we've had, for many, many months, we had daily calls, and then we had several calls a week, and now we're at one call per week with her entire leadership team. And I think the commissioner would agree with this, that she has put together a stellar leadership team in the health department. So as sad as we are that she's made the decision to leave, there's a very, very strong core in the department that is capable of continuing the very, very important work that's going on. We obviously will start the process of looking at candidates, but in the interim, there's a succession order that's laid out by state law in essence, so that there will be a health officer in place. But this is a position that we know is an important position. And I'll be reaching out to individuals and organizations to get their input, but we'll be acting relatively soon on this one.
Thank you. And Sharon's final question is for the health officials on the call. She asks, are you guys having discussions about vaccines? I believe she's referencing COVID-19 vaccines, how they would be distributed and who would get priority.
I can speak a little bit to that because I know that there was some anxiety about this update about having a vaccine by November 1st. And we, I just have to be mindful about what I say or how I say it. But I mean, think about it. The election is that week, right? So we're talking about having a vaccine available right before the election. And we know, all of us in public health and science know that vaccine production, that there's a process, that there's trials, and that we don't want to rush and get something out on the market that can cause harm. We know that there's groups in our country that are against vaccinations, and some of those concerns are related to safety. So why would there be anything that would create or give anyone that has doubts about immunizations and the importance of vaccinations any material to run with? So, we have been talking about vaccinations. We definitely want to make sure it's being done in a safe way. The prioritization, a lot of that is being worked on, and I was able to work on that for pandemic flu years ago when I was at the Milwaukee Health Department. And a lot of that work was led by national organizations, like the one I'm going to, that brought groups together to really vet what prioritization would look like. So I know that will happen this time around as well. So groups like ASTO, which is the Association of State and Territorial Health Officials, and NACCHO, the National Association of County and City Health Officials. Those types of groups will have a significant role in helping dictate what that will look like, providing support to the federal agencies that will be working on the release of the vaccination.
Thank you, Commissioner Kowalek. Our next question is from Sean Kirkby with Wisconsin Health News, and it is for Commissioner Kowalek. He said, you mentioned difficulties with neighboring jurisdictions not enacting COVID-19 orders similar to Milwaukee's order. Do you think Milwaukee County should have its own county-wide public health department rather than relying on municipality agencies? And would that be more of a regional approach that you're looking for? And perhaps County Executive Crowley, he says, do you support or are you looking at establishing such a county-wide agency?
Well, since I started public health, there's been talk of a county health department. So we definitely have heard more conversations about a county health department through this COVID response. And I must say, I mean, if you look at the diversity of our county, and there's very specific and individual needs that our communities have. It would be difficult, I believe, to maintain that type of approach that we have now if we had a consolidated county health department. Some places have merged health departments because of funding. So you have like Madison, Dane County, Washington, Ozark, and others across the country that have went through various mergers because of funding. But we do work very closely together, aside from having a formal unified county health department. We have mutual aid agreements, sharing. The City of Milwaukee Health Department has a lab, so we provide support to the region for various lab samples, which was really helpful for COVID, especially before more testing was available. But I think that's a highly, highly sensitive and political conversation, what the future looks like for Milwaukee County and public health.
Yeah, and I guess to answer that, Milwaukee County is the only county here in Wisconsin that doesn't have a public health department. And when you think about, for example, the mask mandate, it would have made it much easier. But to say whether I support something like that or don't, it really raises many more questions about what would Milwaukee County have to do in order to rise to that occasion. And then how does this affect our mission in as far as making sure that we are becoming the healthiest county by achieving racial equity? So it brings a lot of questions. I think it is something that we have to have a discussion with. And at the end of the day, I think that the best regional approach that we can be coming up with is getting many of our municipal leaders together to really make decisions that's going to make everybody safe as it relates to COVID.
Thank you both. Our next questions come from Patrick Polantoya with WISN 12. He's got a few. So the first one is for Director Rausch. He asks, from what you're seeing in the county, how common is it for people to send a COVID positive child to school or daycare? And how common is it for people to refuse to give information to contact tracers? Are both widespread?
Yeah, great question. Thanks, Patrick. To answer the first part of the question about people sending COVID positive students to school, school's still relatively new this year. I think if I can say it's happened once or twice across the region, or even a handful of times, it's happened a handful of times too many. We need to make sure that people are appropriately isolated and quarantined, and that includes students, faculty, staff, people in other workplaces as well, to really control COVID-19. The second part of your question was about contact tracing, and I'll ask Dr. Kowalik to weigh in as well, but all too often, we have had more and more challenges with completing disease investigations and successfully completing contact tracing. In the early weeks of the pandemic, in March and April, we got really good compliance, but the change started happening around May and June, and we started getting lies, mistruths, just bold-faced efforts to not answer the phone when we called. All of those things happened, and that's a very, very big obstacle to doing the important work we need to do. We have heard stories about students talking to their buddies saying, hey, I'm positive, but I'm not gonna narc you out. I won't tell that you were a close contact. We've heard stories of employers telling their employees, don't say that you work here so you can keep working here. Each one of those situations is a microcosm of the problem that we face when we can't do the important disease investigation and contact tracing that we need to do to keep COVID at bay.
And I agree, it's very troubling that people will go out of their way to avoid and lie. I mean, again, looking at this from more of an individual perspective to a collective approach to creating a healthy, safe environment for all of us. And in the city of Milwaukee, I believe our situation is a little different, where we're dealing with people that are can be very transient. We see this with some of our other disease investigations for, say, STIs and HIV. Also, one of the issues we had earlier on was the city numbers would come up private. So how likely are you to answer a private call? I mean, I do now because I know it's either the mayor or the police chief, but most people don't answer private calls. So we were able to work with our IT department and our vendor and change that so people would know that we're calling. So we looked at a variety of process issues and improve those along the way. But we definitely want people to know that, one, your information is safe with us. We're not going to post a list of everyone that has COVID. You know, we're not going to do that. You know, now we've had conversations about businesses, like the businesses that have received warning letters for the Milwaukee Cares ordinance violation, things like that. That's different. That's why we're focusing on businesses and not individuals. But we need individual information to be able to stop the spread of disease. And we've used the terminology of boxing in, right? And boxing out. You know, I used to play basketball back in the day. So it's the same concept. Like, you have to have the ability to do that. That's what makes a difference. And we need information to do that. So we just, again, want to appeal to our community. One, please work with us. We're doing this because it's not just because it's our job, but we're doing it so that we can save lives. And we also know that COVID is still a new disease. We don't know what some of the long-term effects of being infected with COVID are. So we're trying to also limit that as well. We don't want to create new underlying conditions and chronic illness for people because they've had COVID. So it's in our best interest to continue to work together. We do have contact tracing as one of our 5 key indicators. You haven't seen it green for a long time, but we are hopeful that we can get to that point.
All right, and Patrick's final question, which is also the final question in our chat and for today's briefing, is for Commissioner Kowalik, and he asks, when did your new job come on the radar, and did you know about it when you were reappointed for your current position in late July?
No, so let's see. So I was tapped for this, so it was sometime in July. So the reappointment process was like mid-July. So, you know, I went through the process, but obviously when you learn about a job opportunity, you still have to go through interview process, so nothing's guaranteed. So I would say, yeah, July was when I was notified by the recruiter about the opportunity. My reappointment went through in mid-July, and then I got the offer last week. So you can see kind of the timeline of all of this.
Well, thank you very much. And thank you all again for the important information as we head into a long holiday weekend. We appreciate your time, and we'll see you all again on Tuesday.
Thank you, Catherine.
Thank
Have a
you.
good weekend.
You as well.
Thanks, everyone.